previous videos, I've talked about the surprising advances that have been made for treating mesothelioma. Dual immunotherapy that's now a standard first-line option, arginine depletion therapy that's quadrupled long-time survival in trials, and genetic testing that helps predict which treatments will work best. These are real game-changing options that did not exist just a few years ago. But here's the hard truth. If you make the number one treatment mistake that mesothelioma patients make, you might never even hear about these options, let alone have access to them. That mistake, it's getting treatment from a general physician or oncologist at a local community hospital instead of seeking care at a specialized cancer center that's staffed by doctors with special mesothelioma expertise. Today, I want to explain exactly why this matters so much and how you can avoid making this critical mistake. Hi, I'm Terry Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade, and today I'm going to tell you the single most important decision you'll make about your mesothelioma treatment. Now, let me start by acknowledging something really important. Your local oncologist is probably a very good doctor. They're likely competent and caring and well-trained in treating even common cancers like breast cancer, colon cancer, or lung cancer. But mesothelioma isn't a common cancer. It's a rare disease with only about 3,000 new cases diagnosed in the United States each year. Many general oncologists will only see one or two mesothelioma patients in their entire career, or possibly none at all. Think about what that means. Your local oncologist might be reading about mesothelioma treatment for the first time since medical school. They may not know about the dual immunotherapy approval from 2024. They might not be aware of the pembrolizumab combination that was FDA approved in September 2024 and shows a 62% response rate. They probably haven't heard about the Atomic Meso trial that shows how arginine depletion therapy quadruples long-time survival. And they almost certainly aren't going to offer you germline genetic testing to identify BAP1 mutations. That could completely change your treatment strategy and prognosis. This is not a criticism of general oncologists. It's simple reality. Medicine has become so specialized that even within oncology, doctors focus on specific types of cancer. A breast cancer specialist doesn't necessarily know the latest developments in pancreatic cancer treatment, and vice versa. Mesothelioma is particularly specialized because it requires knowledge that spans multiple areas: thoracic surgery, medical oncology, radiation oncology, and increasingly immunotherapy and genetic medicine. Specialized mesothelioma treatment centers are typically major academic medical centers or comprehensive cancer centers that see dozens or even hundreds of mesothelioma patients every year. At these centers, you'll find multidisciplinary teams that include medical oncologists who specialize specifically in mesothelioma and other thoracic cancers, thoracic surgeons who perform complex procedures like pleurectomy with decortication or extrapleural pneumonectomy, radiation oncologists experienced in intensity-modulated radiation therapy, and other advanced techniques specific to mesothelioma, plus researchers who are actively involved in clinical trials testing the newest treatments. These specialists, they see mesothelioma patients every single day. They know the latest research because they're often the ones conducting it. They have access to clinical trials that are not available at community hospitals. They understand the nuances of different mesothelioma subtypes and how treatment should be tailored accordingly. And, critically, they work as a team to develop a comprehensive treatment plan specific to your case. A general oncologist, they might offer you traditional chemotherapy because that's what they're familiar with, without realizing that for certain patients, Especially those with non-epithelioid mesothelioma, dual immunotherapy might give you better outcomes with fewer side effects. A mesothelioma specialist will know exactly when immunotherapy is the better choice and when combination approaches might be most effective. Also, consider genetic testing. If your oncologist isn't following mesothelioma-specific guidelines, they may not even know to order it, and you could miss out on information that fundamentally changes your prognosis and treatment strategy. Now, I want to take a little break. I just want to take a moment here to remind everyone, if you're finding this information helpful, please hit the like and subscribe buttons. It really helps us get our videos seen by as many people as possible. And if there's a topic you'd like to see covered or a question you'd like answered in a future video, let me know in the comments section below. Also, make sure to watch until the end of this video, where I'll tell you exactly how to access help and resources if you or someone you love has been diagnosed with mesothelioma. Now, I want to tell you about specialized treatment options for veterans and how to access expert mesothelioma care. There's a reason. Veterans make up a significant percentage of mesothelioma patients. It's due to the widespread asbestos use in military equipment, ships, and facilities in previous years. If you're a veteran, you do have some excellent options within the VA system. There are a handful of VA medical centers that have developed real expertise in treating mesothelioma, including the VA medical centers in Boston, Los Angeles, West Haven, Connecticut, and a few others. These facilities have mesothelioma specialists on staff and access to many of the same advanced treatments that are available at academic cancer centers. But you should also know about the Veterans Community Care Program, or VCCP. This incredibly important program was established by the VA Mission Act of 2018. It allows eligible veterans to receive care from community providers outside the VA system, including specialized mesothelioma treatment centers, and the VA still covers the costs. To receive this care, you need to be enrolled in VA healthcare and to get prior authorization or a referral from the VA. You also need to meet at least one of 6 criteria. The service you need isn't available at your assigned VA medical facility. You live in a state or territory without a full-service VA medical facility. You and your VA provider agree that it's in your best medical interest to receive care from a community provider. The VA can't schedule an appointment for you within specific wait time goals, or the nearest VA is way beyond the specified driving distances. Also, if a specific VA service line has been identified as not meeting VA quality standards, that counts too. To access community care, consult with your VA care team. Talk to your VA primary care provider or a member of your VA care team about your mesothelioma diagnosis and your desire to be treated at a specialized cancer center. They'll definitely help determine if you're eligible for community care and submit the referral if appropriate. For more information about the Veterans Community Care Program, you can contact the VA yourself at 1-800-698-2411 or visit the official VA Community Care website. The program is designed specifically for situations like this, when a veteran needs specialized care that's not readily available within the VA system. Don't hesitate to ask about it and advocate for yourself. Now, whether you're a veteran or not, let me talk about how to find a specialized mesothelioma treatment center. Several major cancer centers in the United States are recognized for mesothelioma expertise. These include places like Memorial Sloan Kettering Cancer Center in New York, Brigham and Women's Hospital in Boston, the MD Anderson Cancer Center in Houston, and the University of Pennsylvania's Abraham Cancer Center in Philadelphia. There are several others. Many of these centers have dedicated mesothelioma programs with multidisciplinary teams. You can find a lot of these on mesothelioma.net. You don't have to live near one of these centers to be treated there. Many mesothelioma patients travel to these specialized centers for initial evaluation, treatment planning, and major procedures like surgery, but they can also coordinate with their local oncologist for ongoing care like chemotherapy infusions that can be administered closer to home. This lets you get the specialized expertise you need while minimizing the burden of constant travel. I also want to say, don't be concerned about offending your longtime physician by seeking a second opinion or wanting to go to a specialized center. Any good doctor, including your local oncologist, will understand and support your desire to consult with specialists for a rare and serious diagnosis like mesothelioma. In fact, many oncologists are likely to specifically recommend that mesothelioma patients seek consultation at specialized centers because they recognize the limits of their own abilities. If your doctor discourages you from seeking specialized care, it's actually a red flag. Let me be very clear. The difference between treatment at a specialized mesothelioma center versus at your local hospital can literally be the difference between having access to treatments that could extend your life by years and not even knowing these treatments exist. It can be the difference between a median survival measured in years versus months. It can be the difference between being offered cutting-edge therapies backed by the latest research and outdated approaches. Mesothelioma treatment has evolved rapidly, going from essentially one treatment option 5 years ago to multiple effective approaches today. But that evolution, it's only happening at centers that specialize in mesothelioma. Community hospitals are still largely using the same approaches they used a decade ago because they don't see enough mesothelioma cases to stay current with the latest developments. There's also the issue of clinical trials. Many of the most promising new treatments for mesothelioma are only available through clinical trials before they receive FDA approval. Specialized cancer centers are typically involved in multiple clinical trials at any given time. If standard treatments aren't working for you, or if you want access to the very newest therapies, clinical trial enrollment might be your best option. I understand that seeking treatment at a specialized center can feel overwhelming, especially when you're already dealing with the shock of a mesothelioma diagnosis. It might mean travel. It might mean coordinating care between multiple doctors. It might feel easier to just stick with your local oncologist. But I'm telling you from a decade of experience writing about this disease and talking to patients and their families, the effort of getting to a specialized center is worth it. The outcomes are better. The treatment options are more extensive. Even if you're just looking for better quality of life, the expertise you'll find there is incomparable for everyone, veteran or civilian. Make the effort to consult with a specialized mesothelioma treatment center. Get a second opinion if you've already started treatment elsewhere. Ask about clinical trials and make sure you're getting germline genetic testing. If you do that, you're ensuring that your treatment plan reflects the latest research and guidelines. Your local oncologist can play a role in your care, but make sure a mesothelioma specialist is directing your overall treatment strategy. Mesothelioma is a serious diagnosis, but treatment options have improved dramatically in recent years. Don't miss out on those options by making the mistake of settling for general oncology care. You deserve specialized expertise. You deserve access to the latest treatments. You deserve the best possible chance at extending and improving your life. Visit mesothelioma.net and fill out our form for a free information packet with comprehensive medical and legal information. You can also call 1-800-692-8608 or use the live chat feature on the website to speak directly to one of our helpful patient advocates. They can help you identify specialized mesothelioma treatment centers and connect you with the resources you need. As for me, remember to post any questions you have below. I'll see you next time.